Hello, my name's Ian McCall, and this is another in the series of dermatology for dentists and dental students. We're going to look today at candidiasis in the mouth. Now, as I've said there, it never ceases to amaze me how varied the clinical presentations of candida are in the mouth. The commonest type you're going to get is the pseudomembranous candidiasis, where you get a white semi-adherent patches on a red base. Now, you generally have to take a little cotton bud or a swab and wipe them, and you'll be able to wipe that membrane off. You're going to see this type of psoriasis, type of candidiasis, I should say, in people who have been on antibiotics and have wiped out the normal flora, bacterial flora in the mouth, and candida is overgrown, or particularly in diabetics, or people who are using steroid inhalers for asthma. Because most people don't breathe these inhalers in properly, and they get the inside of the mouth coated with a fairly strong topical steroid, which leads to the overgrowth of candida. There's another variant that's important because it's often not recognized, and that's the variant called median rhomboid glossitis. Now, you see it as a sort of red glazed atrophic area without the filiform papillae in the tongue in that posterior third of the tongue. We'll show you some pictures of that in a minute. Then, of course, if you've got a patient who has a dental plate, then candida can appear underneath that plate, but it will appear as a red irritated area rather than an area that has white exudate on it. So this red area underneath someone who's wearing a plate and who isn't sort of taking it out and cleaning the mouth, that's likely to be an erythematous form of candidiasis. I think the other name they give to this is chronic atrophic candidiasis, or denture sore mouth. The other version of candidiasis that people don't really recognize is angular cheilitis. And this first slide here just shows an example of candida as part of angular cheilitis. Generally, though, you're going to see this in an older age group than this little girl. And in the elderly, the gums tend to, or the bone structure there resorbs. And so the face falls, and you get folds here, which tend to have saliva in them, and it's that dampness that leads to the overgrowth of candida when someone's presenting with an angular cheilitis. There's a few other terms that are used. You know, the generalized red mouth that occurs after antibiotic use is known as acute atrophic candidiasis, antibiotic red mouth. Then you get chronic hyperplastic candidiasis. Now, that has a rough, sort of pebbly surface. It's often on the dorsum or sides of the tongue, and it can have red atrophic areas showing through. In other words, it looks white, but you've got these red atrophic areas showing through. And in this type of candidiasis, it can be difficult to peel the pseudomembrane off. So it's presenting basically as a leukoplakia. It's one of the manifestations of leukoplakia. I've also mentioned here, if you use steroid ointments on the lips, then candida can grow in the vermilion surface. You know, sometimes in medicine, steroid ointments are used for, say, lupus or even lichen planus of the lips. But one of the things that can happen is you can get overgrowth of candida, and it may give you a little bit of membranous candida in the inside of the buccal surface, but often it just gives a glazed, red, irritated appearance on the surface of the lips. So you've got to watch candida if someone has been applying a strong topical steroid to the lips. Now, looking at some of these images, this was a little girl who had chronic mucocutaneous candidiasis. In other words, this is a genetic defect that the child has, which you can react to all sorts of other things quite normally with their immune system, but she just can't react to candida, just can't produce a normal immune reaction. So they can present with angular cheilitis and with quite marked candida on the inside of the mouth. And we'll see here in just in a little minute. Here's another case. Actually, we'll make these images just a little bit bigger and get a chance to have a look at them. Here you can see the angular cheilitis here. You can see the little folds or cracks here. But as I say, she had chronic mucocutaneous candidiasis. Here's someone who had candida presented. They had been applying some steroid to the lips, but they had candida presenting just as these stuck on white plaques, somewhat on the buccal mucosal surface. Here's this little girl again with the chronic mucocutaneous candidiasis. Look how extensive it is on the surface of the tongue here and on the inside of the mouth. You know, just looking at that itself, you might think that's the reticular net-like pattern of lichen planus, but it's just all part of oral candidiasis. And another view of this this little girl. Look at the extent of the candida on her tongue, at the angles here, and on the whole of the inside buccal surface of her lip. This was a picture of dental plate candidiasis. Remember that it looks red and looks atrophic. So it may come up as part of your differential of erythroplakia. But swab this and you will in fact grow candida. That was a picture of median rhomboid glossitis. Remember the type that's on the posterior third of the tongue, and there's a bit of atrophy. You don't see the normal papillae in this area. So again, it's pinkish and it's smooth surfaced here, but this is a presentation of candida. Here's another lady who has been using topical steroids, in fact, on her lips and face, but you can see the extent. This red area here is all due to candida, and swabs of all of these all grew candida as well. So you can see a degree of angular cheilitis that she has with dropping of the skin here, and the saliva that's in here that encourages candida in these areas. But it's the strong topical steroid cream that's allowed this to arise around her mouth. And she did fine with stopping that and using some topical canesten cream twice daily to the area. Okay, those were the main ones that I wanted to talk here. Now, before we go, I want to have a little look at this site, which is very, very good, and I've given you links to it. Exodontia. You can see this is a section in here on Candida. It shows you some pictures of the budding yeast-like organism. This is just a KOH picture here. They've commented there it's an opportunistic pathogen, meaning that if the environment's right, it'll proliferate. Like if you've been on courses of antibiotics, if you're on oral steroids, if you're using inhaled steroids, then this little organism will multiply. Seldom do you get systemic candidiasis. You'll get that perhaps in AIDS patients or patients who are immunosuppressed, and it carries a significant mortality rate. These were the other types that we talked about before, the acute pseudomembranous, the acute atrophic, underneath the dental plate. Median rhomboid we've talked about, angular cheilitis we have. This was just a nice picture of the chronic hyperplastic type. You know, this was the type that can look like frank leukoplakia, and you can't rub that type off properly. So you really would, well, you try swabbing it, but you'd also do a biopsy of this because it would be presenting to you as a probable leukoplakia. These are some other nice pictures of the dentist stomatitis. Just go and click on these in this particular website. It's very good, this for oral lesions in dental practice. I'd recommend you certainly go and have a little read about it. They've mentioned there other types of secondary oral candidiasis. We've mentioned this candidosis endocrinopathy syndrome. This is really chronic mucocutaneous candidiasis. Some predisposing factors with candida. We've talked about the steroids. We've talked about the antibiotics. Just age, infancy. They tend to get it as well before their immune system's fully developed. Endocrine disorders, you know, diabetes certainly, hypothyroidism, perhaps Addison's disease, malignancies. You've got other disorders that are going to affect your immune system, or you've got agranulocytosis where you're not able to mount proper immune reactions, then Candida will occur. That's thymic aplasia and AIDS. And anything that's going to give you dry mouth, Sjogren's you're used to, irradiation, any of these drugs that will dry salivary secretions, all of this can give rise to Candida, and the cytotoxic drug therapy as well. So some other nice pictures here that you should take a chance to have a look at. There's your more typical membranous Candida. You'll see another gross sign of it there. And most cases are treated with oral nystatin. Nystatin's a topical antifungal. It's not absorbed, and so it's given as drops in children. It can be given as a solution in adults. There's also amphotericin lozenges, fungal in lozenges, another oral antifungal that isn't absorbed and it's very good for clearing Candida in the inside of the mouth. External surfaces, I think Lamisil cream is good, or ketoconazole cream, or any of the imidazole creams will work very well. And sometimes you may need an oral preparation like fluconazole. It's particularly used in women who get vaginal candidiasis, just as a single 100 milligram tablet. And it can be very useful for quite extensive oral candidiasis as well. So I'd thoroughly recommend you to have a look through this website as well, and refresh your memory on some of these other forms of Candida. Thank you very much.